Hi, welcome back to our channel. In this video, we will go through the indications of glucocorticoids. We have delved into more details for glucocorticoids and mineralocorticoids in our previous videos. Find the links to these in the top corner of this video. Starting with the skin, topical steroids are applied to the skin to reduce inflammation and itching. They are commonly used to treat skin conditions such as eczema, psoriasis, and dermatitis. Topical steroids come in a variety of strengths and forms, including creams, ointments, lotions, gels, and sprays. It is important to note that excessive or prolonged use can lead to side effects such as thinning of the skin, stretch marks, and increased risk of infections. Topical steroids should not be used on open wounds or areas of skin with active infections. When giving topical steroids, the least potent preparation, which is effective, should be chosen to reduce the risk of withdrawal reactions, whether that's rebound or flare. Please note that a fingertip unit is sufficient to cover twice the area of a flat adult handprint. For lung conditions, short courses of glucocorticoids are used in acute conditions. For acute exacerbation of COPD for adults, prednisolone at 30 mg daily for 7 to 13 days should be taken. For acute asthma in adults, prednisolone at 40 to 50 mg daily for 5 days should be taken. Please note that prednisolone is best taken as a single dose in the morning after breakfast, as this is when it mimics the timing of the body's own production of cortisol. Taking the dose too late in the evening can cause difficulty in sleeping. Moving on to the eye, anterior uveitis is a common inflammatory eye disease. Topical corticoid steroids are applied frequently in the first 24 to 48 hours to control inflammation. The frequency reduces when under control and should be monitored under expert supervision. There are three main dangers with their use. 1. Red eye, which may be due to herpes simplex virus causing corneal ulceration and damage to vision and the eye. 2. Steroid glaucoma due to a family history of glaucoma, atopic dermatitis, or prolonged use. And finally 3. Steroid cataract due to prolonged use. For the nose, moderate to severe allergic rhinitis, nasal polyps, and acute sinusitis are relieved by topical nasal corticoid steroids. It is best to avoid in untreated nasal infections after nasal surgery and avoid in pulmonary tuberculosis. Mometasone and fluticasone have negligible systemic absorption, and metametasone, which has the highest absorption, therefore used for short term only. Please note that using nasal drops have higher side effects due to greater systemic absorption and incorrect administration. For this, use the head down position. And in sinusitis, only high-dose nasal steroids is given if over 10 days symptoms for only 2 weeks. Moving to adrenal insufficiency, which happens due to the inadequate production of steroid hormones in the adrenal cortex of the adrenal glands. It is treated with synthetic steroids, for example hydrocortisone and prednisolone. Increased doses are required in times of stress to prevent adrenal crisis. And sick day rules where patients with fever or infection requiring antibiotics, in which case the daily dose of glucocorticoid should be doubled. And during intercurrent illness, if a patient with adrenal insufficiency is on long-term hydrocortisone, it should be switched to a short-acting due to the quicker absorption rate. A hydrocortisone emergency intramuscular injection kit should also be provided in patients with established adrenal insufficiency in cases of severe vomiting and diarrhea. And finally, adrenal crisis and acute adrenal insufficiency is a medical emergency, and usually treatment is hydrocortisone and rehydration using a crystalloid fluid at 0.9%. And lastly, the gut. Crohn's disease is a long-term condition where the gut becomes inflamed, and a corticosteroid such as prednisolone, methylprednisolone, IV hydrocortisone is used to induce remission in a single inflammatory exacerbation of Crohn's in a 12-month period. It is not usually used in the maintenance of remission. And that wraps up the indications for glucocorticoids. We hope you enjoyed this video. Don't forget to like, share and subscribe to our channel. Drop us a message below or on Instagram at pharmacy4 on topics you want us to cover. Thanks for watching. Bye!